All righty. Good morning, good evening, good afternoon, wherever you are in the world. Welcome to Awake, Aware, Arise today. I am Nessa Donrow. I'm your community manager with Coacharya. So excited for you all to be here. I am currently out in the universe with you and really excited to have some panelists here, Miss Heather McPherson and Nair. We're going to get started in a little bit, so just get comfortable, grab your beverages, maybe grab some snacks. We're going to have a really exciting conversation here shortly. So thank you for being with us, and definitely message us in the chat. Let us know where you are in the world, and yeah, we'll get started in a little bit. So how is the weather? Where are you? You guys are in Toronto, so it looks like a beautiful day behind you, Heather.
Yeah, it's a bit cloudy. You know, it's definitely fall weather, I would say. It's yeah, but nice, beautiful time of year. Leaves changing.
Awesome. Have you always lived in Toronto?
Mostly, yes. Yeah, I was in New York for a stint, but mostly Toronto. Yeah. How about you? Where are you? Yes.
I'm in Wisconsin.
Oh, okay.
Yeah. So I feel, I don't know, I've heard we have some friends in Canada and the UP, so Wisconsin's the closest thing I think we can get to Canada from what I've heard. I have not been yet, but actually, you want to know what? That's not true. I have been to Toronto once. I was on my way to the Costa Rica, and we got rerouted to Toronto to be able to get down there.
So you got to see the airport.
Yeah, in February, no less, in tank tops and flip-flops, getting ready to go to Costa Rica. So wasn't the best first meeting of Toronto for me, but I'm excited to go back at some point. What about you, Hari? Have you always lived there?
No, so for most part of my life, like for the first 35 years of my life, I was in India. So I never had a plan to actually move out. But then life happened. So I recently, it's August of 2016. So it's 4 years and counting since I've moved to Toronto, and I landed in Toronto and I've been here. And I have to say Toronto has been very kind to me and I'm very happy here.
Wonderful. Awesome.
It's a huge move, huge cultural shift.
It was complete, so lock, stock and barrel. So, and it's been an interesting journey. For someone who had never left India or the country, I left life as I knew it and moved, and the only reason was learning, and it's been great.
It's incredibly brave of you. It's incredibly brave of you. Yes.
People say that for some reason I don't know. I don't know what. I didn't have an option in that sense. So that's where coaching really helped me. So when you have certain values and beliefs that you're tied to, and you believe this is the way that I want to live my life, and then something happens, a shift happens, and you realize, okay, so in order for me to get to what I want, things have to move, or things have to change, or I have to change, then you really don't have an option, right? I mean, then you have to go and do what you need to do. So yeah. For me, it was more of a necessity, I guess. But thank you.
No, but it's so true that you say that. I mean, realistically, everything, we don't need to get into the philosophical conversation. We're killing a little bit of time, but it's so true, though. The power of choice, realistically, it's that idea that there is no other option, that to decide that this is the next step, and then just to take it. It's really just a brilliant idea that we choose in the moment. And I think that is bravery. I do think that is bravery.
Thank you.
Oh, yay, Regal has been here so much. Thank you so much for being here. All right, we are almost at time to get started. I'll just wait another couple of minutes.
Is the conference, is it going on the rest of this week?
We are going until October 22nd.
Oh, okay. A couple more weeks.
Yes.
It's been a month.
It's
right?
absolutely crazy that it is October already.
Mm-hmm.
Well, wonderful. Well, I will get us started. We are at time. Again, good morning, good evening, good afternoon, wherever you are in the world. I'm so excited to share time and space with you today. We have an exciting conversation with two special guests. I'll introduce the first here, Ms. Heather McPherson. Welcome. Heather McPherson is the president and CEO of the Women's College Hospital in Toronto. Heather is highly recognized in healthcare as an executive with extensive experience in clinical and academic health leadership. Prior to her role as president and CEO, she served as a hospital executive, vice president of patient care and ambulatory innovation, where she was the forefront in shaping and executing hospital strategy and operations. Heather, welcome. You are phenomenal. You are phenomenal, and I am in awe of you. Thank you so much for being here. I also want to quickly, before I pass it over, introduce our other friend here, Hari. In the session here with Heather, Hari is with us to discuss the Women's College Hospital, which again is a world leader in women's health equity, and health system solutions. It's designed to keep people out of the hospital, really truly support health in the total body experience. So they're developing groundbreaking innovations and addressing issues related to population and health, patient experience, and system costs. This, I feel, is such a vital conversation right now, given the circumstances that we, the global community, are finding ourselves in with this current pandemic. I'm really excited to talk about the innovations that have come out of necessity in healthcare with patient care and how we are supporting the ever-changing environment that comes with COVID. So I'm excited to pair this conversation with you too. Thank you so much again for being here. Heather, I'm going to pass it over to you. You can offer a little introduction and share with us your wonderful insights today.
Thank you so much, and good morning, everybody. I'm here from Toronto, and it's 10 in the morning. So it's a lovely day here. Hope it's a lovely day wherever you are. So thank you so much for inviting me to this session. I'm delighted to be able to share some of the work that we've done at the hospital here, and I think importantly how we've used our forward-looking approach as an organization to the future, how we've helped transform the present. So I won't get into it too much because I know Harry's going to give a little bit of a bit of his background as well, and start us off with some of the questions.
Thanks, Heather. Thank you for that. Hello, everyone, and good morning from Toronto. So my name is Harry Nair. I'm one of the physiotherapists here at Women's College Hospital. And so this conversation, the idea behind the conversation started off from the time since COVID happened, since March, and to the changes that happened. It's been a journey. So when Coacharya came up with Awake, Aware, Arise, and the values that aligned with why the conference is like such a global necessity at this point, it just struck that the work that we do here at Women's, it stands out in different forms, shapes, and the way it's been aligned. So which is what we would like to discuss today. To give some background about myself, I am a physiotherapist, and so I work with the pain clinic here at Women's College Hospital. The pain clinic is one of the specialties we have here, which caters exclusively to people with persistent pain, which is again a broad spectrum of up and coming research and academic involvement, which we need more of in this world. And one of the reasons, or maybe the key reason, that I left my home country, India, about 4 years back and moved here to Toronto, Canada, to pursue further education, learning, and research, and my own understanding of what pain in this world meant. I was treating people with pain, persistent pain, and they used to get better, but I hardly had an idea about what I was doing. I didn't know what I was doing, really. So this was a way for me to educate myself if I may use that. And women's have given me that platform very much whatever that I had envisioned or was practicing back there, it's already in place. And it was actually a very, very successful move for me. And one part of the job is the pain clinic, and another is one of the other revolutionary concepts that humans have developed and perfected now, if I may say, which is hip and knee surgical. So that's one part of my job profile as well, which we will get into more. That's just an introduction. And today we are hoping to cover, or at least broach some areas where women have been really leading the charge in terms of equity of care, health concerns, and inclusivity, which is what I would really love for Heather to talk about or dive into. In terms of a conversation, I might just ask or request Heather to just give an introduction to our viewers in terms of how has this journey been for you, Heather? Like, you've been with women for such a long time. What do you see, like the changes, like then and now? How has this journey been? If you could just start us on that, please.
Thanks, Harry. I'm happy to. So yes, I have been at this organization quite a while. And I think, you know, for me, that the organization, the genesis of the organization over 100 years ago was really filling a gap that existed. And that gap at the time was there was nowhere in Canada for women to train if they wanted to become physicians. So they had to go to the US or abroad somewhere. And then when they came back to Canada, there was nowhere that women physicians were allowed to practice. So the core, I know people, you can shake your head. It wasn't that long ago, actually. So at the core of the organization's always been about equity, and that's a value that runs through everything that the organization does. So in the late 1800s, early 1900s, it was about women, but it was also about the women physicians, and the hospital at the time really served a lot of the marginalized communities that are in Toronto. So we're in the middle of the downtown core here. Throughout time, there are always marginalized communities, and that has been what the organization has stood for. I think in the last several years, and for me, what's really kept me excited and passionate about the organization is the constant look to the future and what's next. So the notion that this work is never done. We're always reflecting on what we're doing, and we're always looking to how we can make the system better. So who currently, again, was women. I mean, there's still a gap in healthcare for women to a certain degree, but there's significant gaps for other communities. And how can, like underhoused individuals, like people who use drugs, like the trans community, and what is it that we can do to continue to try and fill that gap and understand our role, and not to carry on really with the status quo. And it's a different kind of an organization when you're constantly reflecting on what you're doing and thinking about how to reach more people in a different way, or reach the people that aren't being reached through the traditional measures. So, I mean, like any hospital, we could sit and wait and allow whoever comes in, come in. But that's not the decision that we've made here. We've decided to intentionally seek out communities and individuals that aren't being served by the way healthcare is traditionally set up. So, for me as a leader, that's exciting. And I think, we attract individuals here, clinicians, staff, and leaders who want to do the same thing. So, sometimes people will say, it's a lot of change because we are kind of constantly pivoting. But that's the organization. So that's what we stand for, and that's what we're going to continue to do, because the work will essentially never be done. And we want people to work at this organization that are committed and passionate about that, trying to evolve the healthcare system to meet the needs of those individuals that are most marginalized and hardest to reach. So that's what's kept me here. It's you know, it's a passion for me, and you know, remarkable things can happen when you have an organization that is all aligned on that somewhat singular goal. Incredible things can happen.
Thanks for that, Heather. Thank you so much. So that just throws up so many questions for me in terms of, you mentioned that the organization seeks out communities, right, who are underserved or who may not otherwise actually have access to care, or there are those gaps as we identified. Could you speak to those gaps as we identify a little more, as well as like Lumen's? Like, I just wanted to throw this out to the audience that Lumen's was selected, or we are the winner of Greater Toronto's top 20 employers. So Heather was also mentioning that we seek out professionals, clinicians who are passionate about caring for the needs of the underserved. How do we align those values? Or it must not have been, I can totally see, like Nessa was shaking her head earlier, like to see this change happen. And as human beings, we are really resistant to change, right? I mean, we don't really like change, and it's hard to change. And as you mentioned, our hospital has been pivoting like every single day or every other week and month, and now with ideas. So my question again is like, how do we deal with this change, Heather? What has kept the values aligned, and how do you seek out these professional clinicians?
Yeah, thanks, Harry. You know, it's something we reflect on quite a bit as an organization. It's, you know, one of the things that I like to use is storytelling. It's a way to, you know, engage with people that, you know, when most people come to choose to work in healthcare, there's got to be a seed there that of compassion, that storytelling will resonate with them. And you know, when you frame the desired future state in a compelling way, that it's impossible for people to resist, it makes it easier. They may still not want to do it, but it's hard for them. It's hard for them to dispute that the outcome is not the outcome that we should all be striving for as human beings and societies. And that, you know, that's, you know, part of the vision of the organization is healthcare revolutionized for a healthier and more equitable world. And, you know, taking that and having conversations with all parts of the organization. Everyone has a role to play in that. And, you know, it's how we treat our people, how respectful we are to our clinicians and staff in the organization. It's, you know, telling stories about the community we're serving and the difference that we're making in people's lives. And, you know, it's the constant engagement and asking questions that has started to become part of our culture here. And you know, I think now to a certain degree, people know that they're going to be supported if they're advancing something that is going to might otherwise be seen as breaking a rule. If it is in the service of equity, if it's in the service of improving somebody's outcome or access to healthcare, then that rule is open for the breaking. And we'll figure out a way to get around some of the other pieces. Of course, it has to be safety first, but you know, I see lots of examples of frontline teams making those local decisions on a day-to-day basis, and they're not asking for permission, they're just doing what's right. I mean, I think as we all know, we're in the middle of this terrible worldwide pandemic, and here at Women's College, we were back in the second week in March, started an assessment center, COVID assessment center. And, you know, we're seeing, you know, hundreds of people a day and doing swabs. And, you know, it was new to the healthcare system, and so new to our, people who are providing care. Of course, our community, lots of anxiety, and within the first couple of days, we realized a lot of the individuals that were coming in for testing or were symptomatic were people who lived in group homes, in congregate living environments. Again, some of our most marginalized individuals. A lot of the people had mental health and addiction issues. So, the kind of, I guess, the wrong thing to do would have been to test the individual and send them back to the group home while they waited for the results, which could be, 24, 48 hours, because in Toronto, those environments are often ward type rooms. So you could have 4 or 6 individuals living in a group home, for example, or shelter. The first, I think it was the first or second day, one of the frontline staff said, well, we can't send this person back to their shelter. Then that whole shelter, if they're positive, that whole shelter is going to be positive, and by the end of the week. So we decided, and we're not an inpatient hospital, we're exclusively outpatient hospital. We decided that we needed to actually keep people while they were waiting for results. And so those decisions were made. I found out about it. I was, of course, very supportive. Like the first or second night, I think we had 3 or 4 people sleeping over while they were waiting results. And, to me, that's a sign that people are really embracing and living, the hospital values, and are, thinking about it in a way that's active. It's not of the 500 people we swabbed today, 495 are going back to their environment and are probably going to be able to, self-isolate and be fine. But there were those people that just didn't have that, and we had to have a different solution. So it's, those are the kind of local, I guess, small steps or small actions that I see, to me, signal that this is an embedded value. And, and then those stories, of course, we talk about and we acknowledge that, that's what we want people to be doing, in the moment, making observations, seeing individuals that aren't managing well, and helping improve their lives, even if they were only there for a 2-minute NG swab. That's an opportunity to improve somebody's life. So we quickly, after that, once we started to realize the individuals that we were testing, and that we had this moment where they were, otherwise might not have ever come in the doors of our building, we had a moment to make an impact. So we, quickly moved to have some of our other roles, like our social workers and mental health therapists, activated to actually, work the lines, as we say. So we are often, as I think you see across worldwide, people lined up, like, why waste that opportunity? Let's walk up and down the line and find out how people are really doing. Like, are there food insecurity issues? Are there housing issues? Are people going to be challenged to self-isolate if they're positive or while they're waiting? All of those kinds of things, and actually enact change in the moment. And, again, we've got some incredible stories about, elderly people, about, homeless people, about, people who have, it's just a very difficult, environment for them to survive on a day-to-day basis. So what can we do? And this is, it's got nothing to do with COVID. I mean, it does and it doesn't, right? I mean, it has everything to do with COVID, and it has nothing to do with COVID, because this is their lives, whether there's COVID or there's not COVID. So that's, I think, for me, a bit of a pivotal moment. And then, other things that, so why would we be making all of the individuals in shelters come to the hospital for testing, understanding that those individuals have lots of often mental health issues, and that's a difficult thing to do? Why wouldn't we go there? Like, we know it's a high risk environment. Why, when we know that we have that knowledge, why do we continue to kind of perpetuate the same old way of doing things, that you have to come to us? How about we come to you because we know it's a high risk environment? and let's just go and swab everybody that wants to be swabbed, and we'll work to help contain and strategize with those shelters and group homes. So many of these organizations we had absolutely no relationships with prior to the pandemic, and we've got, I think we visited environments, hundreds if not thousands of since March, of organizations where individuals with severe mental health issues living in a group home, youth with significant physical disabilities that live in congregate living settings, like all of these terrible situations, and these environments have outcomes. And we have the ability, it might not be our normal business, but you know what, we figured it out. It wasn't necessarily perfect the first day we started doing it, but it's gotten better along the way. But it's, again, holding that vision about what we stand for, and that everybody's got a role to play in that. I know it's a long answer to your question.
I would say not long enough, Heather, but thank you for that. It just captured everything. It just, what you said and what you were referring to made me reflect on like the past 6-7 months and the personal journey that I've had over the past 6-7 months. And as Heather mentioned, I was and I still am one of those frontline workers. We are all, like at Women's, we are all still, so that's an interesting thought that came to me, that how easy it is for us to normalize, or that need for us to normalize things. And this is what we have seen over this summer, and how now that the numbers are going up, we are just changing our thought processes back to what it used to be. It's a coping mechanism, I would understand. And I'm just reflecting on how this journey has been for myself. When COVID started, March, it was life-altering in every sense of the word. I've had to relocate basically 4 times during the past 6 months. I moved, so when my living arrangement initially involved somebody who was like high risk, so I was not comfortable going back home to that person, so I had to actually move out. So I moved out to an Airbnb for the first couple of weeks, and then I moved to another short-term rental while I was trying to seek out another living arrangement and option. That didn't work out by the end of June, so I had to still go back for a couple of weeks, and all this time I was jittery. Like I don't really mind about myself, but I could not live with the thought of passing this on to somebody else. And then finally, mid-June, July, I think, like dates and times blur, but I found another living arrangement now, so where I'm like it's a longer term arrangement. And an interesting thought that came to me was that through this, I don't know how many people know of that, but the hospital really helped out, and I was financially supported, and that really helped me with this shift. So these small things that these create such huge impact at a individual level, and the drive for us to give back is manifold then. I don't think it's often that we hear the CEO of an organization say, oh, yeah, we are cool with breaking the rules. Like, was that the rebel in you, Heather? Yeah, but this is what comes down to us. So at the front line, we have that freedom, even within the clinic. Like, I am so thankful to be working with my team and the professional, my colleagues, peers as well, the physiotherapy team, the education team here. It's stupendous. It's amazing the kind of support that we have and the leadership that we have, in which we have freedom, flexibility, and the power, the autonomy to make decisions, to think and come up with creative ideas, which is what I think Heather was referring to in terms of having or hiring clinicians with ideologies aligned with the organization. And I believe that's so powerful, and that so many other organizations can take heart from or take heed of. Which is probably the only way that we can actually survive as humanity, moving forward. It's probably the need of the hour. I mean, we are not islands, right? I mean, we need to work together, and I believe that's key and imperative, that if we want to change or see goodness in this world, it cannot be done by just isolating ourselves or being in our own shells. We need to change, and we need to evolve with what's happening, is my thought. And one thing that really struck out was when Heather said that the things like what Heather mentioned, I don't know if it really comes across, or the gravity of it, like the significance of it, the innovative ways that that we actually went to those areas where people who would not normally walk into the doors of a hospital to get tested, the change or the difference that it actually made, it helped us flatten the curve. I mean, like, it's amazing. And as a hospital, so we are a day hospital. What does that really mean? Like, the hospital is basically designed to keep people out. Like, we would really like people not to come into the hospital, which is not your everyday healthcare model so yeah, I mean, it's a 360-degree turn, right? So to say, like, I mean, this is one industry where we did not like repeat customers. We don't want repeat customers. We want new ones, of course. We will take care of them, but we don't want repeat customers. So what does that really mean is that we don't have an emergency, or we don't have an inpatient unit, but what we have is an acute ambulatory care unit where people can stay overnight or couple of days, and at most 3 days now, which is what we would talk about when we speak about the translated surgeries, transitional surgeries. Those people, they really need to stay back, but otherwise the surgeries that happen here are either same day discharge or maybe overnight, like 24 hours they stay and then they get to go home. So that's the kind of model that we are moving towards, and it's saving money, it's saving effort, it's actually helping revolutionize healthcare in such extent that people are actually getting better faster than they used to. When I went to school and learned in uni and all of that, like hip or knee replacements were a 3-day procedure. Like, patients used to stay back for 3 days so that they can recover. And really, like, over the past 15 years, medicine has improved so much and anesthesiology has improved so much that we've realized the reason people stayed back was for pain management. And now with technology, we've realized, okay, the same experience people can have at home, we can support them from the hospital. So people used to go home with apps and tablets provided by the hospital, and we used to monitor them from the hospital, and they get to go home on the same day. And we realized, as when they are in their own home environment, as I was mentioning, people tend to recover faster. They get back on their feet faster, and their recovery rate is so much better. So what we did here during the pandemic was we actually literally created a new inpatient unit, and that wasn't easy. Within couple of months, we actually converted what used to be an acute ambulatory setting into a completely acute inpatient unit so that we could offload patients from the partner sites so they could actually handle the emergency patients or the COVID positive patients. So for me, when looking at from an organizational perspective, those are key changes that needs radical thinking, that needs revolutionary thinking to actually implement and execute. So I'm amazed by the support and the concern that the hospital had for every single employee while we were at it, as well as moving forward. So Heather, could you speak to us about like the employee wellness and where is that thought? Like when we think about the organization, this is the organizational goal. We need to get here, and we need our people to be safe as well. So all of these considerations, these thoughts in creating employee wellness programs, assistance programs, how does that tie in with the organization? How do we align them?
Yeah, I think that's, I think all over the world, everyone is now, challenged with this. I think, people, as I say, particularly in healthcare, the first wave, there was a bit of a, adrenaline. That's the mode that a lot of healthcare providers do well in. And there was a lot of adrenaline and a lot of can-do attitude. I think as time has gone on, brief reprieve, but we're back in it, the thick of it again here in Toronto anyway. So, we've got a workforce that is, is feeling a little low, I would say. And, how do we make sure that they have the supports that they need to do what society needs them to do, which is provide healthcare. So, a lot of healthcare was slowed down or stopped during the early parts of the pandemic here. And so there's a huge backlog in things like elective surgeries and, specialist appointments, those kinds of things. And, people need their care. So we need to help our staff and clinicians be in a position to provide that care. So, from the very early days, I mean, I'd like to believe that I'm quite a transparent leader, and I was quite honest at the time, at the beginning, that we didn't have all of the information, but we were doing our best to gather it, and we were always going to err on the side of safety. So, it was safety first, here when, mask, everyone wearing masks in healthcare in the early days, there was lots of controversy about that. We were one of the first adopters to do that within like the same day, essentially, that the recommendations started to come out. So, always, I think, really showing, there's talking, and you can be inspirational, and, say the right things, but it's the actions that actually are what matters and what people will remember. I got a lot in the early day because I've always been, I think, fairly accessible to staff in the organization, and I was getting, many dozens of emails from frontline staff and clinicians about things that were concerning them, things that they observed, ideas to make life better, and we did pretty much everything. So, again, there were people that were here. Some of our food vendors closed down in the building. They kind of moved out, so it was hard to get food. So we arranged to have food for people. We arranged to have free coffee for people every day. Just little, very little things that, obviously cost money, but in the grand scheme of things, if people feel that they're being supported, that we're having some compassion for the circumstances they're dealing with. It's been very difficult. Healthcare is a predominantly female workforce, and many of our staff have children. Schools closed. It's been a really difficult juggling act for people. So they're working in a stressful environment where they're having to be practicing the best infection prevention and control practices to keep our patients and themselves safe. And then they also are going home to families where they're, as we heard from Harry, very, scary, where you feel like you might be the vector for somebody that's could be at very high risk if they were to get COVID. And in those early days, we didn't totally understand the transmission the way we understand it now. So again, things like initially when we opened our assessment center, we had, which has now become a best practice, I think, across our jurisdiction anyway, but we were, I think, the first to have the, we call it the infection prevention and control police. So we have someone standing there watching our healthcare providers put on their personal protective equipment. It's quite a process on what you put on first, second, third when you hand wash, and then it's not exactly the reverse order to take it off. So it's quite technical, and it's easy to forget. And, a lot of our providers have been, in the business for a long time. And, as we know, you get into ways of doing things that, are fine when there's not a pandemic. And when there's a pandemic, they are definitely not fine. So we had, someone standing as each staff member walked into the assessment center, watching them put on their personal protective equipment. We had the same thing on the way back, on the way out. So people who, again, watched them take it off and suggested and directed them. This is all in the service of keeping people safe. And it was keeping our patients safe, but it was, those kinds of things that are fairly straightforward to implement, really resonated with the staff that, the organization really cares for me, like really is, wants me to be as safe as possible. And, there were all sorts of things. There was concerns in the early days about being on the elevator with our patients. They had COVID, was that safe? So, again, we rearranged the hospital basically so that we've got a path for staff only, elevators for staff only, lots of things that I think all, every suggestion that came our way, we, talked about in a town hall. We did our best to make a change. Some things we couldn't change, but where we could, we would. And I think that's served well for the organization to feel safe when they're here, and when they feel safe, they're able to provide the care that they need to our patients that we're serving. So it's if We can signal to people that we understand, and we talk about it, and we believe it, and we do it, that we're flexible. So there's terrible situations that our staff are in where they're looking, they're single parents, they're looking after children, they've been sent home because the school has a case of COVID, and they're out of their holidays. Well, we're not gonna make our employees financially at risk because of this. We will figure out a way to make sure that they get the support that they need so they can do what they need to do as a parent, so that they can then come back to work, and that this should not be something that is a financial burden on them, because they are, we need them to do the work that they do at the hospital for society, really. So, I think, to me, and, we'll continue to look at those ways of things that we can do to show that we are listening, we're caring. I mean, I think, Harry was talking a little bit about having to move, and, we just don't really understand, I think, as a society, the implications that have been for people, and the sacrifices people have made, through every sector. I know the healthcare sector the best, but I mean, we have many clinicians, physicians who, literally have moved out of their family home because they were afraid to pass the virus on to their family, and just huge personal sacrifices in order to believe and live to their fullest ability to be a healthcare provider. So it's it's really remarkable that that people have the higher mission sometimes, and how do we continue to speak to that and compel people to continue to hold that is true, and help them execute on something that's so important to society and so important to them personally. When we support a long-term care facility, so this is a new it was a new situation. So again, I think worldwide, long-term care have been some of the most vulnerable groups that have been hit by this pandemic. And what happened here in Toronto is we were partnered with a long-term care facility. So there's one a few blocks down the road from us. We were partnered, and when it became clear that they were in a position that they couldn't provide the care they needed to because they had an outbreak, both with their residents in long-term care, but also with their staff, they couldn't provide the care they needed to because their staff were sick and at home and or were quarantining. That we asked our hospital, if this facility needs our help, and who would like to put up their hand and go work at a long-term care facility for a while. And, again, to my, amazement and delight, we had over 20 people put up their hand and say, I'll do that. And, this is, as we know, the kind of some of the most challenging environments to work in, even without a pandemic, let alone with a pandemic, and, really, really difficult to enforce good infection prevention control practices with this population. That there were 20 people in our organization that were willing to go and serve there was, I think, a testament to them feeling that the organization had their back, that we would do everything to make sure that they were safe there, but also that, these 20 people lived our values, right? Again, this was an organization that was in desperate need for more hands. And so we had people who they weren't working in their normal capacity. They were working often as, healthcare assistants, and they might have been a nurse practitioner working as a healthcare assistant. It didn't matter. They were helping hands. And, that went on for, I think, a good 3 or 4 months until the organization was able to recruit, to their outbreak got under control, to their staff came back who were off on quarantine. And, I think, we quite likely might be doing that again this fall, but, I think it was a an experience that, has changed our organization because it demonstrated compassion at its core. So I know the question started off with change, but I think to me, I've always said for me, my approach to change is, engagement and, to listen, to reflect, and not be afraid to alter or pivot if what was going on before is not working for the go forward. And I think constantly doing that, being present, being available, taking comments seriously from everyone. I think it's got us to a place where people are, we're all aligned on what we're trying to do here in the pandemic and as an organization going forward.
Absolutely, Heather. So yeah, I was one of those people who worked at that long-term care, and it was an amazing, it was a life-altering experience, I would say. The camaraderie or the living those values. Yeah, it wasn't easy, but it was. The lessons that we took away from there, that'll stay with me for the rest of my life, I'm pretty certain. You very interesting couple of points that you mentioned, Heather. Regarding the different sectors that we are actually looking at. I have colleagues like my teammates and people who have families, who have kids, and they find it so hard to juggle these multiple roles, and the uncertainty, as it is as human beings, we don't do well with change, and when it's infinite, this is what we see with our pain world. When there is a pain which we do not know where does it come from, and we do not know when it's gonna end, like we don't do well with that kind of infiniteness or like that uncertainties, which is what everyone across the globe, the world, we are experiencing currently. And especially, I know, like, I mean, our sector, like the healthcare sector and the education sector, teachers, I mean, people are going through such massive changes. We were personally, like, this has been my observation that the healthcare sector and the education sector are the two main areas where change is like really difficult, but we were the ones who had to actually change and move roles and provide care in different ways that we had never even thought of before. So my question, Heather, right now, like the real question that I'm struggling with, what I hear from a lot of my friends, people who are dear and near to me, is again, like, are things going to go back to the same like before? Like from someone in your position, from your share, like what would you say, Heather? This is just a yes or no question, but not to come to, but just feel free, Heather, like, are we going to go back to the same as before?
Yeah, I don't believe that it can. I mean, we've learned so much. We've evolved as an organization. The whole system has evolved, and we know what we know. And we know that, some of these congregate living environments, whether it be long-term care facilities, retirement homes, group homes, shelters, are very difficult living environments, pandemic or no pandemic. And, we failed, we've as a society have failed our most vulnerable people. And, the demographics, I think worldwide it's the same. It's certainly here in Toronto. In our most, socioeconomically challenged communities, that's where the percentage of COVID is the highest. So it's just our most marginalized are being differentially impacted by this, and that's not acceptable. And, we can pretend that we haven't observed and we haven't experienced, and we can pretend not to look at those data that exist, but we can't. We've got a significant social problem in our society right now, where the marginalized and vulnerable individuals are not being supported in the way that they need to. And it, whether it's housing, whether it's food security, whether it's healthcare, whether it's access to medications, whether, on and on and on, it's confounding our ability to be a society that I think we all believe we could be. And, we need to change, and we need to be on the path to not that happen again across the world. So, I mean, I believe there will be, going forward, there'll be very different models. I mean, here in, Canada, we've, things like long-term care, people just took for granted that you get to a stage in life where you have, physical, cognitive, or other impairments, that was your course, that can't be the course. And I don't think any of us want that to be our future, because as it stands today, that would be our future as well. And we all need to work to change that. And that's, how do we, reconstitute the system as we understand it, so that the resources are available for people to live in the living environment that they choose. And what do we need to bring to bear to make people successful in that? And that is about being the hospital to keep people out of hospital. And technology is, has provided a great opportunity for us to have reach that we didn't have before. We only dabbled in. As again, all healthcare around the world is fully embedded in this model. It's not perfect. So, there are populations that this will not work for, but for many populations it will. And how do we really take all that we've learned and turn it into the solution for good? That's my personal belief. There's no way that this organization here is going to be going back to the way it was. So we've already changed our strategy. I mean, we're halfway through our hospital strategic plan. And I mean, that's the guidepost. I mean, it served us well, because some of the things that our strategy had embedded in it was around equity, was around marginalized communities, and also was around virtual care. And we've done a refresh of that, and we've, as I say, we've turned down the volume on some things that, although at the time seemed like really important work to do, doesn't seem that important anymore. And we've turned up the volume on the things that we know matter, like caring for, the aging population, like other vulnerable groups. Here we see a lot of very vulnerable women, and, how are we actually coalescing all of the organizations that are involved in this work together to, again, improve that system that has failed people during the pandemic. And it probably was failing them before, but we've just really shone the spotlight on it now. So it's, it's about being humble and having some humility that we didn't quite have it right before. So
absolutely, yeah. I mean, that just throw some light on things were not perfect before, and it just came to our attention, right? And it's just been in the forefront. And also, Heather, like these are movements, the people who are, we are very involved with people who cannot directly access care, as you're mentioning, like the virtual care, you mentioned technology. So I'm just being the devil's advocate here, in the sense there are people who cannot access, who are not able to technologically, or due to other reasons, who are not able to access virtual care. How are we supporting them as well? The Black Lives Matter movement, that's also something very close to your heart, as I know. How do we do this, Heather? What is your vision for the future as a CEO?
Mm-hmm. Yeah, I mean, the first step, I would say, it's been on our radar as we were looking towards advancing virtual care, that there was the so-called digital divide. It's sometimes surprising who, and it's not always who you think is going to have challenges in that environment. So we started fairly early looking at it from a research. I mean, we are an academic hospital, so we have a research institute. So we have some projects underway understanding, really does virtual care increase access or decrease access? And, it's interesting, and I think it's early days, and there's some literature out there, but I mean, you can imagine, for example, in the mental health arena, which is where we've done some of our research, that there's so much stigma associated with mental health that providing a virtual option that people don't need to leave their environment, their home, sometimes even their workplace. They can close the door and have a consultation. Really increases access, which is wonderful. But then there's some people who technology isn't going to be available for. So for me, it's always going to be there will always be at least 2 streams, if not 3 streams. And what we've been doing with one of the programs during COVID, we have a COVID Care at Home program that is supporting people who have COVID more in the mid-range, so they're symptomatic. They're not quite at the stage where they need to be hospitalized, but they're not well. So we're monitoring them with a team of clinicians, and we are making sure that they have the technology at home. So we are making sure that the technology is there, and we are setting it up where we can for them, and instructing them how to use it. So there are, this creative ways that you can do that. If they don't have it, you provide it. Or if, always the option for face-to-face would be there, or our providers going and out to environments where we know, people will, would naturally convene. So if we say, there's a portion of people who will never walk through the door of a hospital for a variety of reasons. I'm thinking of our Indigenous communities where the implications of being in a hospital are, too much for them to bear. Then there's, a group of people who don't have, for a variety of reasons, access to technology, that would do it that way. And then there's, the third way was, and we go there. So it's to me, it's whatever it takes. So we do have, providers right now embedded in, a refugee clinic down the street, in a women's shelter that's in our community. And, so those are great ways to try and bridge that digital divide where the virtual is not going to be the option for them, and nor are they going to come into the hospital. So it's bringing care to them. We've learned a lot through the pandemic, going and swabbing. We did some swabbing in some Indigenous encampments in the city, providing healthcare at the same time. Like it doesn't need to be in a consult room. It doesn't need to be, it can be in an encampment, and you can still help people. So it's really shifting that, that way of thinking for our providers, and letting the community know that we're open to exploring different ways of creating access for populations.
Heather, I can't tell you how empowering it is. Like when I hear you say that, we'll do whatever it takes. That's something that really translates down well, to provide care. We will change, we can break the rules in order for the greater good. These are things which really resonates, and I'm very, very happy to be here. Thank you for that. I'm mindful of the hour, so we're almost on the hour. Just as a thought, winding down, 2 things that really I would like you to share with us is, one, how do you take care of yourself? This cannot be easy. How do you do this? And this is an audience of coaches. What would you leave with us from an executive point of view, as well as from the clinical background that you have? What can coaches look forward to in terms of addressing the coming days? I'm thinking ahead. I knew when this started, I think the messaging I got was, this is not a sprint, this is a marathon, so pace yourself. But no one told me this was a marathon for like 2 years. This is going to go on for a while. How can we prepare ourselves? When we spoke earlier, you mentioned a keyword which stuck with me, which you said, listen, reflect, evolve. How do you see this happening? What is your, what can we take away from this, Heather? What would you leave with us?
First, just say I have a coach, and that I meet with regularly, and even during and things were very intense. I certainly needed her more than I ever did. And one of the things that she had reflected to me some time ago, which is something I do every day on my way in to work, is to really think about how do I want to show up today? Like how does Heather want to show up? What am I standing for today? What is it? What message do I want my team, the organization, to be left with? And then kind of act accordingly. So, of late, that message has been, somewhat empathy and compassion for people, because, again, everybody is dealing with this in different ways, and wanting people to feel that they are, I understand that this is really, really difficult. And I don't have the solution to everything, but I hear what they're saying, and I understand what they're going through. And then, today, for example, we have a town hall right after this, and it's a virtual town hall. And, my message that I want the organization to feel is one of strength and confidence, that, we've been doing this for several months. We've been doing it very well. We've managed to protect our staff and our patients, and we know how to do this, and we can keep on doing this. And we're going to provide more support and resource for people to continue doing it, understanding that it's harder this time, this way. So, I think for me, really holding that, what is it at the end of the day that I'm trying to get people to reflect on, then, hopefully cascades through the organization. For me personally, to me, this is so important, such important work. And, I genuinely, of course, care about the organization. I've continued to be, exercise, I eat well, I have a family who, thank goodness, and, I walk the dog every day when I get home. And, I've really, really tried to continue, I meet with, when I exercise, I do it with, a walk or a run with some friends. So, really trying to keep some, some fun in life, and I try and create some fun at work too. So we have, hopefully we have a good time. And as we know, the world and the tragedies of the world and the tragedies that happen here are not going to stop. But how can we be, in the face of that, be resilient and forward-looking and support each other and do the best that we can. So, I think those are the kinds of things that, for me, make a difference. And, I get energy by improving the system. Every time I hear that we've created a different way of doing something that's improving people's lives, I mean, that in itself is the most energizing. That really helps. So I'll close there. I know I think we have some questions. I see. Is that right?
Yes. Thank you for sharing that. Yeah,
Yes.
Nessa,
Steven, Hari, did you want to take a look, or I can.
Sure. This is from Harish Devraj, and I see that. Heather, I think the question is, what is your early sense of the new challenges healthcare employees are likely to be facing in the post-COVID scenario? Absolutely. How do you intend to support them in coping? So I guess Harish is basically asking, this is something we're all experiencing now, burnouts, right? I mean, how are we going to cope with these burnouts? And it's a great question, yes. And how do we, Heather, what's your take on this, please?
I mean, it's complicated, right? I mean, healthcare has seen a lot of people retire and leave the professions, I think, during this time, and that's a bit of a worldwide trend. We have that combined with because, and again, this changes, depending on what jurisdiction you're in, but here in the early days, we didn't have students, we didn't have learners coming into the hospital. So these are the, physiotherapists to be, the doctors to be, the nurses to be. And that was more from the schools, the academic institutions stopped. So now we have another problem where we've got a whole bunch of almost ready to practice healthcare providers who haven't quite finished up yet. So we are madly trying to, since July, actually get those learners into our healthcare environment so that they can fulfill. I mean, of course, we've been doing everything virtual that we can, and we still are with them, but they, at some point, they, you know, an anesthetist needs to practice an intubation, or a, you know, a surgeon needs to practice stitching, you know, like they have to have the in-person experiences for them to meet the requirements of their programs to graduate and to be healthcare providers. So we've got a, you know, we got a bit of a supply demand problem going on right now. It is making us, or causing us, to think about different kinds of healthcare workers in the system, and you know, who else is out there. And for us here, and I know across the system, we know, and we've seen during this, that, you know, many healthcare professionals have, you know, fairly expansive scopes of practice, but they, you know, they get kind of, you know, this is your role in this environment here, and they're not necessarily practicing to their full scope of practice. So most professionals want to practice to their full scope of practice. So one of the ways that we're looking at is really trying to explore how to let that happen by, you know, in a way of being able to, you know, bridge some of those gaps that we have. So it, you know, it's kind of a dual purpose, that we know it's what people want on one hand, but it'll also help fill some of the, potentially the voids that we have. But I mean, I think we're going to have to think about teams in a very different way, and people are going to have to cover, you know, it's, you know, we've here always really supported team-based care. Some teams do it better than others, but often within a team still there, everybody still has their kind of role and their, you know, particular function. I think we're seeing that people are spanning different functions. And again, you know, there's ways of doing this that, you know, doesn't put people or patients at risk, or clinicians at risk. But you know, how can we do that? And yeah, I mean, I think, again, you know, in some towns and cities and rural areas, the hospital is the largest employer in the whole town. And when you start to see people being sick and having to stay away, and, you know, I mean, it's devastating. So it's, you know, working as a system, more like what we, you know, we talked about a little bit earlier, where, for example, at the time we were able to support 20 of our staff going to a long-term care facility to help out. You know, could be that we need the help in a couple of months. So, you know, maybe, you know, and maybe some other organization or sector is doing okay, and maybe they can lend us some staff during that time. So it's, you know, really trying to think openly, and not kind of revert back to, you know, our kind of siloed way of thinking. But you know, I would say it's you know, to the earlier conversation, that we're never quite going to be the same. I think all of our staff and clinicians are never going to quite be the same either. And it's, you know, if we can have instilled in them that the organization cares for them, that they are important, then I hope that they will stick with us and help us through that kind of recovery period. And although it won't be business as usual, it will be a business that is meaningful.
True, yeah, we are looking at a new model of care, I would think, and we just had 2 students who graduated with us, and if not for this posting, they would not have been able to graduate. So it was certainly different in the way we provided learning or education. So there's another question.
Yeah, I see that question. It's a great, you know, it's a great question. And we actually have implemented in one of our areas what we call health coaching. It's a program, it's a peer health coaching program, actually, that we have in a cancer prevention program that we have here. And you know, it's proven to be very, it's early days, but it's proved to be successful. I mean, you know, coaching isn't, you know, I'm an occupational therapist by background, but I mean, there's there's a lot of parallels in, you know, coaching and in helping people imagine a different future or a different outcome than what they might be experiencing in the present. So what is the barrier that I feel that I have, whether, you know, could be a physical barrier because of a stroke, or cognitive barrier, or a mental barrier that you can't seem to move forward to fully realize your potential. I mean, I think that they are in many ways one and the same. And it is about, you know, providing people with the tools and the tactics to realize that. I would say we've probably, on the coaching side with our patients, I would say it's come in more of a frame of health professionals that are already seeing them and providing some of that forward or future looking. And it probably is somewhat hit and miss, I would say, depending on who that is and what their comfort level is in the kind of some of the underpinnings of coaching, as how successful that is. But I certainly take that as a good thought for one way to help bridge where we are and where we're going to find ourselves with the future. So it's a great suggestion, great question, which I take was a suggestion as well. But when I first started reading it, I thought the question was going to be about coaching for, you know, staff and teams. And, you know, I think that for sure, I mean, our executive team has coaching in place, but, you know, how are we extending that across the organization? So when people are at those junctures, you know, instead of stepping away from, you know, being a nurse for the last 20 years and because you've just really can't do it another day, like how can we help someone, you know, stay at Women's College Hospital, help them with that kind of transformative future, you know, goal about what can they do that's not what they were doing, but how can we support them to do that so we can keep them? I think it's, you know, again, something that we should be really thinking about as a system.
Nessa, did you have something on your background yesterday when we were chatting? You were asking about the changes within democracy, locally and globally, the changes that were happening in healthcare systems. Nessa had some questions yesterday. I was just trying to recollect what that question was. Yeah. I can hear you.
Yeah. Can you hear me now?
Yes. Yeah.
Hi. So, oh gosh, my head is spinning, you guys. So a couple of things on that note. I'm going to come back to your original question, Hari. So first off, Heather, a little bit of background. In another life, I say, like, before my own personal awakening, I was in the healthcare space from a staffing perspective. So I worked for a managed service provider, and I was managing the contingent workforce program, so temporary contract staff, traveling medical professionals for, you know, everyone else. So I was managing the contingent workforce programs for a few healthcare systems in the Midwest here. And so I shared that with Hari when we had gotten to connect. It was a very interesting experience to be able to see hospital operations from that perspective. And so when you were sharing a variety of things, I was taking little notes here. Like, I love how cognizant you are as a CEO of the ripple effect of what you do. You were talking about a couple of the small innovations that you have made that are just completely different from any models in healthcare that I've seen, to really take a proactive step to not just symptom manage, but really go to the core and really solve something and like cause a ripple that's going to be changing healthcare in your community is amazing. It's absolutely incredible. So I admire you and I applaud you for that, because so to speak, you're at the top of the pyramid, if you will. So for your mission to translate down to the positions on the floor and outside of the hospital and be executed on, it speaks a lot to how passionate you are about your mission. It speaks a lot to the leadership that's happening in the hospital. It speaks so much to the compassion and empathy behind patient care. And it's so not about symptom management with you. And as a member of this global community, like, I am so grateful for you both, because you are doing something different, and it might be a little more common in Canada than it is in the US. And I definitely have not seen the other side of all of the healthcare systems in the US, but what I can say is, and I'm choosing my words carefully, but my experience was so profit over people. And I had shared an instance where I recall I was communicating with a department manager of the ICU, and patient ratios were consistently at like a 3-to-1. The burnout of staff was high. Travelers, it's difficult to find the exact medical professionals you need based on how, what trauma level the facility is at, et cetera, et cetera. So traveler burnout from the experience. So it was just a cycle, an unbroken cycle, where the healthcare, the medical professional shortage, we just can't meet the demand for the ill right now. And so I recall just moments where, as the broker of the relationship, I'm connecting with department leadership, and thankfully, the space that we held and the rapport that we had, they felt comfortable enough to be vulnerable. But it was heartbreaking to see the tears and the compassion, because they simply just want to provide the care that is a part of their personal mission. That's like why he or she became a medical professional in the first place. And so when you were talking about staff burnout and just the care and the remembering that they're a person and their feedback is valuable, it might seem so small, but I can tell you, like, that is the ripple. Like, that is the little grain of sand that then brings you to, great scores for the hospital, great scores for the system, which is something that I always heard about. What are our scores? What are our scores? What are our scores? What are the people really feeling? What are your staff feeling? They can provide compassion and empathy when they're operating from that place, and when that's a part of their immediate environment, when that's a part of their community, when it's a part of the communication and the leadership. So that was a huge soapbox for me to jump on, but I just, hearing you speak about what Women's College has done gives me hope, like so much hope that that there still are innovators out there that are, aware of the mold, but don't choose to be restricted by it. Like, that is incredible. And something else that you had said too, I wrote this down, and hopefully I can find my original thought, but I wrote down an old belief system about getting old. I think you were talking about kind of just people just accept that there's a deterioration at some point. There just are going to be limitations in this human experience with what our health can look like. And I just recognize that when you said that, like, aging, that is a belief system. It is a belief system about the care, what we've predicted our bodies will be, what we predicted our community will be, what we predicted health should look like, and then the assumptions that we made from that belief system, and then what we do from it. Like, I'm just so very cognizant right now of all of the ripple effects. And I think it's the intangible things that you're incorporating at women's college that is the game changer, because it starts here and it starts here before we actually see the results out here. So I don't even know if that really truly answered your question or what you were looking for me sharing, but that's just what I had that I just had to share with you. I'm so grateful to you that you are doing the work that you're doing.
Thank you. Thank you. It's yeah, it's you know, like many things, talking about it helps. And you know, kind of affirmation from people that like you, Nessa, and others. I mean, that helps as well. You know, I've always been the type, and in the Canadian healthcare system is different, and then certainly the U.S. and, you know, every country has their own. But you know, I feel like I'm a believer, if it's the right thing, that the money will sort itself out. The CFO here doesn't always like my approach to that, but you know, so far it's worked. And you know, if you can really demonstrate transformation and innovation and that it's better, it's a hard argument not to fund it. So, you know, I think the program Harry works in chronic pain, that was the, you know, you create a scenario that, you know, is so compelling. You know, when something's not working, that the future state is so compelling, it's impossible, make it impossible for people not to align with you.
Yeah, I agree. Nessa, that was a great recap. Thank you for that. You just made my day when you said that. I mean, Heather, the talk, or whatever that, the word hope, right? I mean, that's what we live for, you know. So with the chronic pain world, this is something that we find people after they've been from pillar to post and there is no reduction in their pain, and you're constantly living with pain, you tend to lose that. We tend to lose hope, we tend to lose faith. And if nothing, if just that one thought is a takeaway from this, I think our work is done. And thank you for that recap, Nessa. So thank you, Heather.
Oh, you're welcome. I just this was a powerful conversation. It's everything that we need right now. It really, truly is. Again, Heather, I both of you, just the authenticity you have behind this mission and the self-awareness that you carry with it and continue to develop, taking pieces of feedback all over, even just simply a question from an audience member. And I saw your gears turning as soon as you saw it, you know, and I'm curious about what you're going to do with it, you know, and how that's going to evolve the strategy. So just the fact that the agility that I hear and your perspectives and how you're seeing what healthcare could be, it's exciting. I think I can speak just looking at the US, health systems shouldn't be as huge as they are when it comes to, from a business standpoint. I mean, yay, when it comes from growing a traditional business, wonderful. Like you had mentioned before, we're not looking for repeat customers. We'll take new ones, but ideally we'd like to get to a place where, you know, where you're not getting your VIP member card and, you know, you're stopping in and you have great rapport with the hospital staff to, you know, to a certain degree. And the other thing that came to mind, and again, forgive me, an abundant mindset. You have an abundant mindset. You'd mentioned it will come back, you know, and yes, I can understand that maybe a CFO based on their job description is really specifically supposed to be a little more black and white than that. I appreciate that. But I think it's really great that, you know, it's your leadership too and your partnership with your colleagues that will help them operate from that place. And you guys can stay aligned in your mission. You can be much more efficient and effective as you spread this. And I am certain I truly am. I am certain, and I'm looking forward to the day, whether it's online, on social media, some kind of headline, one of you guys send me an email, but when this just changes healthcare and it comes back, and suddenly I'm seeing that either in team or I don't know, coming to healthcare systems in Wisconsin, and they're going to be that change management. They're going to drop in these new systems. We're revolutionizing healthcare. We're offering health to the community and the means to do it. This will happen. This will happen, and just know that my heart, as another leader in the world, as a human being in the world, I am so behind your mission. Is there anything, as we're coming to close, that I guess you would recommend, for all of us non-medical professionals who are having this experience, we're having conversations with our friends and our family, and of course we're trying to support the right behaviors, the right mindset, the right lifestyles. Maybe if you can just touch on that and just say, hey, to everybody out there, stay here, show up this way. What would that look like?
Yeah, I mean, I think, when for both in the hospital and in my, personal life and community, that, to me, it's look after each other. That is the, really what we all have to do. I mean, we just, people are, the peaks and valleys in this with people's emotions and people's sense of positivity or negativity is, for different reasons at different times. But if we can all keep an eye out for each other and realize when somebody might be dipping and, help, stand up and help. And it doesn't matter if that's your neighbor or your partner or somebody you work with or, somebody you're online with, like we all have to be looking out for each other. So this is the kind of time for solidarity. And it's, I think it's the single most important thing that will help us as a society survive. If we can just, truly look after each other or in whatever way that we have, available to us.
Mm-hmm. I love that. I absolutely love that. And I am in 100% agreement with you. Hari, did you have anything to add on that note? Any perspective you wanted to share?
I completely agree with Heather. That the redeployment to long-term care had taught me anything. That's probably what I could share is it's just that it's just the same cliched one, right? One for all and all for one. It is truly that what I've seen, what I've realized, I would say, is that each person makes a difference. We all can make a difference standing together. And right now, the world needs it more than at any other point in time. We need everyone to be together. We will have that open space. We will have our space. But today, right now, right here, all of us, we need to come together, save ourselves, protect ourselves, as well as our families and community. So it's global. It's not just limited to oneself. It is global, and we realize that. However, one person can make a difference. That would be my thought. So, yeah.
Wonderful. On that note, I don't know any other way that we could possibly close this. I'm a feels person. I'm all in my feels. I am grateful to you both. Sincerely, sincerely grateful. I know there's miles and miles between us, but I see, I can feel, I am certain of the effect in the work that you are doing. It is creating change in the world. And so I know that there are days when you guys are resting your heads on your pillows and you are exhausted and you probably don't know how you're going to do it again tomorrow. I hope that brings you peace. I do. I hope that brings you a great deal of comfort. I hope it re-energizes you. I hope it helps fuel your mission. We need you to be doing what you're doing. And so thank you. Sincerely, thank you. This was an honor to be here with you guys. I look forward to seeing all the updates at Women's College Hospital, and I wish you both the absolute best. Thank you so much for sharing this with us.
Thank you, Nessa, for facilitating. Created a great space to feel comfortable. Absolutely. Thank you so much.
Thank you.
Wonderful. Absolutely. My pleasure. My pleasure. Everyone, thank you again for joining us. This was wonderful. I hope you found great value in it. I know I did. On a note, we had mentioned about the uncertainty of this time, and we will have another session coming up in just a few hours regarding how we can manage the uncertainty and what that can look like as we move into the future. So thank you again for being here, everybody. And let's continue the conversation. Be well and have a wonderful day. Thank you all.
Thank you.
Thank you.